How to prevent cracked nipple for breastfeeding mothers. This is absolutely important because when your breast is cracked, you will not be able to feed the baby. It is absolutely painful. You cannot feed that baby, and the breast gets engorged. It is another difficult situation to manage. That is why it is better to prevent nipple being cracked. And again, I want to highlight that there are different types of nipple for different women. You have variations of nipple. Some theirs are protruded, which is very good. Some theirs are inverted. Some theirs are flat. You cannot differentiate the nipple from the breast. All these things are variations of nipple and they have effects on breastfeeding. And before I start, I want to tell you, if today is your first time of seeing this video, please kindly subscribe to this channel and turn on the notification bell to get yourself notified whenever I upload a new video. You are welcome. How do we prevent this cracked nipple from occurring in the first place? It starts when you're pregnant. If you are pregnant and you've approached 7 months, you will start managing your breast, getting the breast ready to breastfeed your baby when delivered. How do we start? If you have a protruding nipple and everything is fine, good, you start by using cotton wool and petroleum jelly to clean your nipple, round the nipple. When you're cleaning this nipple with cotton wool and petroleum jelly, you find out there's a black particles coming out. These are the particles that clog up the opening of the nipple and could prevent milk from flowing faster as soon as the baby is delivered. But when you remove those things and you also stimulate the nipple, getting the nipple ready for the work ahead, it makes it a lot easier. And as soon as the baby is delivered, the baby finds no problems getting breast milk because the nipple is opened. And again, remember that you have to eat well so that breast milk will flow. And when all these things are in place and you latch the baby well, do not allow the baby to suck only the nipple. Do not allow the baby to suck only the nipple. This causes crack on the nipple. The baby has to latch the areola, that black parts around the nipple, the black part around the nipple, then the nipple. If he latches or if he sucks only the nipple, that's where the problem is. You have to latch both the areola and the nipple. The areola is the dark part. In case you don't know what areola means, that's the dark part of that breast. This makes the baby relax and sucks and gets full. Then while positioning the baby, it could be another challenge. If you don't position the baby well, it can also cause cracked nipple. You have to put your palm under your breast, your palm, then allow the baby to latch. You don't do it this way, no. Some people put the nipple in between their fingers like a scissors, no. You use your palm and bring up the breast and allow the baby to suck the nipple and the areola. And the baby latches well, you won't have problem breastfeeding this baby at all. Despite the fact that the first week of breastfeeding when you deliver initially is painful for most women because they're trying to, naturalize with this breastfeeding thing. Yeah, but after a week, it disappears and breastfeeding becomes pleasurable. Of course, it's a pleasurable experience for both the mother and the child. Then again, if a woman has a flat nipple or has inverted nipple, it's another work to be done on it. During antenatal, you will learn how to use cotton wool and be pulling it out with petroleum jelly gradually, not to hurt yourself. You will do it on daily basis, at least 2 times in a day. Use cotton wool and petroleum jelly or shea butter as the case may be, and you're pulling the nipple out. And in the worst cases, if it's bad, we ask your partner to suck it out. Yes, your partner helps to pull the nipple out by sucking. Then if it's also flat, is the same process. You'll be pulling it out, getting this nipple ready for breastfeeding. If you don't do this and baby comes out when you give birth, the baby will find it difficult to suck breast. And when the baby sucks and sucks in order to get milk and nothing is coming, your nipple gets cracked and it is painful. It leads to breast engorgement, and automatically you cannot breastfeed that baby again. The only alternative is for you to express, which is also painful when you have engorgement, to express and give the baby. Because you must let that milk out, or else it causes a bigger problem. So it is better to avoid it. Do this that I've taught you in this video. Make sure that by the time you are getting ready to deliver, to give birth to your baby, you've given your breast enough management. You have taken care of that nipple, getting the baby ready so that you won't have the problem. It will be a story. Other people will tell you the story. As far as you listen to this video and do what I tell you to do, people will tell you story about cracked nipple, not you yourself telling, because you have done the right thing you're supposed to do and you are enjoying this period with your baby. Thank you for watching. Do not forget to give this video a thumbs up, like, and share. Share this video to people who needs to hear. This is absolutely important. Thank you for watching.